right. Right now we seem to be able to share our screen and we are able to share the audio, but I'm not able to show you my beautiful face. So that's the only issue. But I think everything else is working. So we are going to get started. Um, we're very sorry for the little technical problem that we are facing. Maybe what is happening is that there is a storm around here and GoToWebinar has faced some problems. But nevertheless, so let me start with a little bit of introduction. My name is Sonali Shivlani, and I'm a pregnancy and postnatal consultant. I have been in this profession for more than 16 years now. Right? And it is something which is fun for me, which is a pleasure for me. Also, I have 2 children. And that is the biggest certification that I hold more than anything else. All right. So today's session has been brought to you in association with Cordlife. Cordlife is one of India's leading stem cell banks. And I would really like to take this opportunity to say a very big thank you to Dr. Pallavi for giving us the opportunity to speak to you. Right? I have been asked to speak to you today on the topic called exercise for a healthy pregnancy. So now this is one of my most favorite topics, right? It has the 3 most favorite words in the world that I like. I love pregnant mothers, I am a health freak, and I love exercise. So we are going to talk about all my favorite topics today, and I hope I can be entertaining enough without you being able to see my face. So let's get started. Just a couple of ground rules before we begin. If you realize all of your audios are on mute, you are not going to be able to speak. That is deliberate because we want you to have a seamless experience. We want everyone to learn properly. So whatever questions you have, you can see on the dashboard, there is a question box. Please put all your questions there, right? Before I close the session, I will personally make sure that all your questions are answered and everything is taken care of, right? So that's the first thing. Second, make yourself comfortable. Don't worry about if you don't want to take notes. If you want to write something specially for yourself, that's fine. But otherwise, the Cordlife team will be in touch with you soon after the session, maybe 1 or 2 days after the session, and they will be sharing the recording of the session for you, with you. So you will get all of the slides and the talking part as well. And last but not the least, at the end of the session, I'm going to be sharing a gift with you. So all the participants are going to get a gift voucher, which you can use for a little bit of shopping. How exciting, isn't it? So great. Let's get started. So these are the different stages of pregnancy, right? I call them the different trimesters. So first, second, and third trimester, of course, you all know, which is the 0 to 12 weeks. We are also talking about the second trimester, which is 13 to 27 weeks. Then you have the third trimester, which is 28 to 40 weeks. And I definitely also have a fourth trimester, which is the postpartum period. So I think the requirements for pregnancy are different, and the discomforts and the challenges and the problems that you face may be there in all the trimesters, but there may also be, issues which you might face in the beginning, like nausea, for example. Many women, by the time they enter their second trimester, are very comfortable and they don't have the feelings of nausea, etc. anymore. So let's start talking about what we are dealing with in terms of exercise. The first and foremost, and do not forget this, before you begin any exercise program, always consult your doctor. This is very important. Your pregnancy health is the most important for us. So if you are going to be careful with yourself, that is very essential. Make sure that you check with your doctor. Most pregnancies are healthy, and for most pregnancies, everything is allowed. But sometimes it might be a challenge, and therefore you should be always cautious. Here are a few things that I would like you to keep in mind. Start slow. There's no rush. We are really not catching a train from one part of the city to the other part of the city. We don't need to become Formula One racers. So we are going to go slow. If you have not done any exercise before, it is a good idea to start with a few counts, with few repetitions. Don't try to do something which is excessive. Don't try to do something which is a lot, right? The second thing is, if it is something new, try to get some supervision for it. At least, even something like this where you know what you are doing, where you've seen the positions, where you've seen the postures, you understood the benefits and etc. It is always a good idea to do less counts, but in the correct posture. So if you've read somewhere that, oh, I should be doing 100 squats, and you may hear it from me as well, that you should do 100 squats during pregnancy, but that is not what you have to do. What you have to do is keep in mind how much works for your body, and you do it in the correct way. If you feel any kind of discomfort, stop. There is no need to continue with unless and until you get yourself checked. If you notice any warning signs, please stop. Okay? These are the warning signs that we are talking about. If you feel cramps in the abdomen, it's like as if your uterus is getting some kind of contractions. You should stop. Leaking of water. Your baby lives in amniotic fluid. This amniotic fluid is supposed to stay intact. It is not supposed to leak. So it is very important that you should take care of this and be alert and aware. Excessive vaginal discharge could also be coming from the cervix area. So you should be prepared for noticing that as well. Any kind of vaginal bleeding should always be reported to the doctor. And if there's anything which is abnormal, which doesn't feel right, so a little bit of aches and pains, maybe a little bit of, after doing exercise, maybe my buttocks hurt a little or my thighs are feeling a little tired, that is understandable. But anything else is not what we are concerned. Anything else which is abnormal, you should definitely report to the doctor. Here are some exercise myths. Right? First and foremost, exercise will cause a miscarriage. Not true. There are a few things that make a difference, right? There are two things which work towards a delivery. One is your pelvis, which is the bony structure. So if you were to place your hands on your hips, if you can feel those bones, that's your pelvis. The other is what I call the cervix, which is the mouth of the uterus. If the cervix is tightly closed, any stretches that you do on the pelvis is not going to result in any problem. So don't worry. The only thing that we make you do exercise for is to make the pelvis more flexible. So at the time of delivery, the baby can come down much faster. Exercise is not going to impact fetal development. A lot of times mothers have this myth. If I exercise, my baby is not going to get enough nutrition because all my nutrition is going to go towards exercise. Not true. Exercise will make you feel exhausted. Again, this is a myth. Exercise will, yes, it will make you feel a little tired in the first 2-3 days. But as your body gets used to it, trust me, exercise will actually give you more energy. Exercise will overheat and dehydrate you. Not true. If you wear the right clothing, if you drink enough water, exercise is not going to cause these things. Weightlifting should not be done during pregnancy. Now, this one is a big statement. Weightlifting, yes, for lower body we do not do, but light weights, 1 kilo for the upper body, for your arms, for your shoulders, is completely allowed. You should not exercise on bed rest. Now, this one is a little bit that you should always understand what your bed rest means. Many times what happens is that you may be on complete bed rest. You have to be lying down totally flat and even maybe elevate your feet. In that case, you may not be able to do anything. But in some situations, you are able to sit up. So you can do certain gentle movements like rolling your shoulders, stretching your arms, pointing and flexing your feet. So some things can still be done. Deep breathing. So all of these are options, right? It is not important to warm up or cool down. Never be in a hurry. A lot of times people will say this, that okay, let me just finish my workout and I'm done. That's not true. You have to make sure that your workout is absolutely proper, and your workout should start with a warm-up and a cool-down. Let me first start with the correct pregnancy posture. When I'm talking about the correct pregnancy posture, it starts with how you're sitting. Now, if you can see this picture, it has a woman on the left side. The way she's sitting, she's slouching. This is a wrong posture. This is definitely going to result in backache. And isn't it true? Backache is one of the first things that women are always complaining about during pregnancy. And then they blame it on pregnancy. They'll blame it on, oh, I didn't have enough ghee. The third thing is they may blame it on an epidural. They'll just blame everything else, but they forget that they had an incorrect posture during pregnancy and post-delivery. So whenever you're sitting, always sit erect. Always ensure that your back is well supported. Do not slouch. Another thing that you should keep in mind is your standing posture. Now we understand that your abdominal weight is increasing. So the curve in your back becomes naturally more exaggerated. It becomes more pronounced. And due to this, you get backache. The other area which increases in size is the chest. So your breast area also increases, and this causes you to hunch forward. So your shoulders are hunching, your back is curving, the buttocks are protruding. So it becomes a very uncomfortable situation for your back. Hence, it is important that you should always stand erect. You should push your shoulders back and you should stick your chest out. That is going to be a correct posture for standing. Now let's talk a little bit about prenatal exercises. I'm going to again remind you that it is very important that you first consult your doctor before you start any exercises, even though it is being shown to you like this. You should first check in with your doctor and then start. There are lots of benefits of exercises to moms. It is going to help to release, ease all sorts of back pain and other discomforts. And when I'm showing you the different exercise postures, I'm going to tell you what kind of discomforts it will help to solve also. Isn't that exciting? It will boost your mood and energy levels. It's going to help you to sleep better. It will prevent excessive weight gain, increase stamina and muscle strength, reduce the incidence of pregnancy complications. Isn't that something which is important? When you exercise, your hormones stay in check, which means things like gestational diabetes, thyroid imbalance, hypertension, all of these can get greatly reduced. And this one's obviously important, smoother labor and birth. Who doesn't want a short delivery? Who doesn't want less pain during delivery? Me! That's the general statement. When I was pregnant the first time, trust me, I was so scared. And this is 20 years ago. I was so scared that because I had heard only negative stories, that I wanted to kind of, say that I don't want to go through labor. But because thankfully I was active, I was fit, my labor was so smooth, it was just like removing a hot knife from butter. And then of course there is a faster postpartum recovery. Your recovery can happen much faster, you bounce back much faster because your body is healthy. Pregnancy is a 9 months period. Tomorrow if I want to run a marathon, I can't. I have to first go and practice. I have to first prepare. And that is very essential. So keeping that in perspective, important point is that the 9 months that God has given you is to prepare your body for the event which is labor and birth. So let's make the most out of it and not waste this time. Now, in the eventuality that you don't know that, what can I do? I'm not supervised. I'm scared. I don't want to start something which could be wrong. The first thing that you should surely do is start a walking program. I wish I could show you, how the pelvis would move when you're walking. But unfortunately, since the video is not working, we're going to imagine this. Just stand up wherever you are and place your hand on your hips. Okay, place your hand on your hips on both sides and now slowly, gently press just below your abdomen. Can you feel two bones? Those are your pelvis bones. That is the start of your pelvis. Okay. Now, when you move, take one step forward. See how that bone moves. It kind of just gives you that pelvis movement. Take another step forward. Extend your leg to the right. Extend your leg to the left. You can feel the pelvis move, right? So this is what a walking program can help with. It helps to increase the elasticity and flexibility of the pelvis. Now you can sit down, okay? All the practice is over right now, okay? All right. I think Dr. Pallavi's audio is also working. So just a moment, let me check if she would like to address the audience right now.
Good evening, Dr.
Yes.
Are you able to hear me?
Yes.
Hi. Good evening, all of you out there. Hearty welcome to you. So the technical glitches, it goes on. We need to accept them as well. Now, most of the patients keep asking me, how do I go about walking because it's Corona time? So my suggestion is fix up the timing of the clock on your wall. Am I audible, Sonali?
Yes, ma'am, we can hear you.
Really ask the patients at the convenience of their home, fix up the time on the clock. So make it a 45-minute or a 20-minute short break. Keep walking the longest distance at your home itself. Because now not every one of us can go out and walk in the current era, at least for a couple of months now. So please fix up 2 points in the house and fix up your timings and keep walking until that time. And whenever somebody knocks your door or you need to get up and attend, don't hesitate. Just pull up yourself and go do some work and get down. Some amount of agility is very, very important for a pregnant woman. So, Dr. Sonali, you have stressed on it very well about the exercise, importance of exercise in pregnancy. Please go ahead. Thank you.
Thank you. All right. So I was talking about a walking program, and as ma'am has suggested, you can walk at home. I was going to give you also a suggestion that if you have a terrace in your building, if you can kind of, go up and walk where there is nobody else, in this Corona time especially, then you can also do that because you are not exposing yourself to other people. So where there are the basic idea is there shouldn't be too many people. Now in walking, you don't need any supervision. We've learned how to walk when we were children, when we were toddlers, right? But it's very important that you should wear comfortable walking shoes. We just go in our slippers, and that is not the right way, because then what will happen is you can twist your ankle, you can hurt yourself, you may not be able to walk that long, your feet will hurt at the end of it. So wear good walking shoes. Wear cotton clothes. Remember we spoke about dehydration, getting overheated. So if you wear cotton clothes, you will definitely be able to walk better. The weather is so humid now that it gets really, really stifling if you don't wear the right clothes. Don't go on an empty stomach. Please eat a small snack, right? But don't eat a big meal. It's a very common thing that after dinner, everyone's going for a walk. That's not how it should be. You should have a small snack, carry a bottle of water. Please walk at a pace that is comfortable for you. Don't overdo it. But don't also have a walk where you can easily have a nice, big, long conversation on the phone. It is very important that you are focused on your walking. You can enjoy yourself, you can put on some music, and you can do a walk like that, but don't talk and walk. That is not the idea. Listen to your body. You have to aim for about 30 minutes. And if on a given day you're feeling better, you can do a little more. But if you feel tired once in a while, then you can take a break. Don't push yourself. Okay? So listen to your body. Most of the time, you should be able to do 30 to 45 minutes. If you're feeling tired every day, then it is a good idea to get yourself checked. Because why should you feel exhausted every day? Right? Now let's show you a few simple exercises. Again, Corona times, right? What is it that we can do at home also? So along with walking, these are some nice, safe and simple exercises that you can do in the house. Okay. So the first one is neck rotations. When we're looking at neck rotations, and since you all are sitting here at home with me, let's try this. This is a very safe movement. Just sit erect, correct your posture, slowly drop your chin to your chest, drop your head back. Once again, drop your chin to your chest, feel the stretch in the back of the neck, and drop your head back, feel the stretch in the front of your neck. Come back to standing position, face forward. Now slowly drop your chin to your chest, left ear to left shoulder. We're going for full rotations. Back of the head to the back, right ear to the right shoulder, and bring yourself back to chin to the chest. What are the benefits of this? This is going to improve circulation to your head. And the basic problem generally is sometimes you feel headaches, you feel a little bit of, dizzy spells. All of these can be greatly reduced because the circulation to the head improves. So this is something that you should keep in mind. Do this on a regular basis. It seems very simple. It can be used as a warm-up or a cool-down also. Now this one's also really easy and again does not require permission from your doctor because it does not involve the abdomen, the baby. We're talking about wrist rotations. Let's do the exercise first and then I'll tell you why you're doing it. Okay? So let's hold your wrists out. Hold your palms out nicely. Make circles and please do it really slowly. Nice, slow circles. First do it one way and then now let's do it the other way. 2, 3, and 4. Okay? Why am I doing this? Sometimes what happens is that due to pregnancy symptoms, circulation becomes a little less and you might get swelling in your fingers, swelling in your wrists. This is very common for people who do a lot of computer work. So if your job involves sitting in front of a computer screen all the time and typing away, there is a good possibility that you get swelling in your wrists, you get pain and discomfort in your wrists. Another tip that I always tell mothers is that every time you should do a quick pregnancy check yourself. Remove your finger ring and put it back. If it goes in and out easily the way it used to before pregnancy, then that's perfect, right? If it is not going in and out easily and you have to struggle, then there could be two things. It could be either there is swelling, so we should take care of that, or you could be gaining weight. And if you're gaining excessive weight, then that's not a good sign as well. So doing wrist rotations will help to reduce the swelling for sure. So take care of it. If it doesn't go down, again, I'm back to your doctor because it could be elevated blood pressure. So it should be brought to the attention of your attending doctor. These are the foot flexes and ankle rotations that I was speaking to you about. Even somebody who's on the bed can try a little bit of this. So let's do it together. Stretch your feet out. Now point your feet. So you'll feel the stretch on the top of the foot. And now flex your feet. Pull your toes back towards your body. You should feel this in your calves. Can you feel it? Amazing. Let's try it one more time. Point and flex. Point and flex. And then now let's rotate them nicely and slowly. First one way. Do a full ankle rotation. This is excellent for your ankles. Many times pregnant women complain about two issues. One is swelling in the feet and pain in the feet, and two is leg cramps. Okay, let's complete the circles one more time. 1, 2, 3, and 4. And let's reverse it. 1, 2, 3, and 4. Okay, so number of counts will depend on you. Sometimes if you have a particular issue, like as I said, if you've got swelling in your feet, suppose you have a job which involves you to stand a lot. Maybe you stand in the kitchen a lot. So your feet are getting a lot of swelling. Sometimes when you sit in one position for a long time also, that can cause swelling in the feet. So people who are sitting in one position or standing in one position for a long time should constantly keep doing this every 45 minutes to an hour. Nowadays, we are all working from home. So you're not even in office. Otherwise, I used to always tell mothers, if you're working in office, you shouldn't just, send out an email, or you shouldn't just pick up the phone and call a colleague. You should walk to the desk of the colleague. Then you should maybe go to the bathroom. Then you should walk down and drink water. So do a lot of movement. Never sit in one position for a long time. The same thing will apply even now. When you're at home, don't sit in one position for a long time. It may be very tempting that I can now sit down and watch TV for hours. And nowadays, I mean, with Netflix and Hotstar, one program, second program, third program, they start so fast that it is so difficult to resist. So don't sit in one position for a long time. Keep doing these exercises. It will help to improve the circulation in your feet. The other thing that I mentioned was cramps in the legs. And there is one more exercise which is coming up later, which I'm going to show you. And I'll talk about cramps in the legs at that point of time. Because basically what happens is that during pregnancy, the circulation reduces. And that sometimes you get up in the middle of the night with your calf completely hard and it's paining. It's like a cramp. Now that's one of the reasons is poor circulation, sitting in one place for a long time, not moving around, standing for long hours. The second and third things could be that we may be drinking less water, or we may, have some kind of a movement thing. So make sure that you are having adequate fluids and you're doing your exercises for your legs. This is a butterfly position. I'm going to call this my favorite exercise because it makes you sit on the bed. You can watch TV while you're doing this, and it also helps to stretch out your pelvis. So the way you do it is, of course, because this is stretching out your pelvis, you need your doctor's permission before you start. So bring your feet together as close to the pelvis as possible, and then bring the knees as low as possible. So that's a butterfly position, right? You can either hold it or you can go up and down in slow movements, or you can flap up and down the way a butterfly would flap. Okay? So this is a position which you can sit in for as long as you feel comfortable. If you feel that, okay, it is stretching too much, then you can straighten your legs out and you can rest them and again come back to being a beautiful butterfly. This is your cat and camel. And some books also will call it the cat and cow pose. And it typically is great for your lower back and your upper back. It's all about the back here. So if you're getting a lot of back pain, if there is discomfort in your back, trust me, I have had mothers who will be doing this kind of a position even sometimes in the middle of the night because their back is hurting so much that they try to do this exercise to just get some relief. So it's really simple. You have to get onto all fours. Make sure that your knees are hip distance apart and your arms are below your shoulders. And the first thing you're doing is arching your back like a cat and looking up at the ceiling. And then you're rounding your back out and you're looking down at your navel. So first you're the cat and then you're the camel. This exercise is called the pelvic tilt. And this is also excellent, excellent, excellent for your back. So your back is the one which is taking the first hit, right, during pregnancy. That's the one where we want our massage all the time. I'm sure the husbands will vouch for that. So it's really important that you keep working out your back. I would recommend doing most of these exercises on the floor on a mat because at least you will not slip, fall, not have an incorrect posture. So now lie down flat, place your feet on the floor. Your knees are going to be pointing towards the ceiling. Your arms can be next to your hips. And slowly, you're going to do this really slowly. You're going to raise your buttocks off the floor. Hold it there for 3 counts. 1, 2, and 3. And slowly drop it down to the floor. And then you can repeat it again. Lift them up slowly. No jerky movements, please. Always really slowly. Hold it there. 1, 2, and 3. And then slowly settle it down. Again, you can do a few counts of this. Maybe you can do this every few hours, just 2-3 counts here and there. You can always have your yoga mat on the floor so that whenever you get time, you can just get some of the workouts done. This is my leg raises. I start with lying down on my side. My lower leg is folded and my upper leg is straight, right? So what I'm going to do is I'm going to raise my leg all the way up to 90 degrees and then drop it down. And then once again, raise it all the way to 90 degrees and drop it down. I would recommend starting with at least 8, but then working your way up as your stamina increases, as your strength increases. Most of the girls in my classes are doing at least 24 to 32 counts per leg. But again, I'm not giving you a target. I'm not saying that this is what I want you to do. But I'm saying that this could be your goal. This could be something that you should try to work towards. Build your stamina up slowly. Don't do this on the first day. But hey, if you've been doing it for a couple of weeks, 3 weeks or 4 weeks, then you should be able to also do it, right? So build your strength, build your flexibility, build your stamina, and get these done. Why am I doing this exercise? Simple. It's going to make your pelvis more flexible, and it's excellent for your labor preparation. So this one is also a labor preparation exercise. So far, this is the second one we've learned, right? The first one was the butterfly. Second is the leg raises. Here's your third one, the squats. Everybody tells you, please clean, swab the floor, right? Do your squats, do your duck walks. So squats are of course excellent. They're going to help to stretch the pelvis out. And I would recommend that you should take a nice firm chair so that you have some support. You can also use the wall, or you can also use your husband. Come on, those nice firm strong shoulders, they have to come in handy sometimes, right? So take some support so that you don't wobble. Your center of gravity has changed. So we don't want you to fall or injure yourself. So take support and widen your legs and slowly come down in the squatting position, making sure that your back is tall and straight. If you can see, the knees are staying within the toes. They're not crossing the toes. So this does not injure the knee joint at all, right? Again, we're starting with about 8 squats every day. But, and shall I give you the target? Of course I should. I love to. Most of my class is doing about 80 to 100 squats every day. But again, I don't want you to start doing 100 squats on the first day. I swear you will curse me. And I don't want to be cursed. I want to be loved, right? So what you're going to do is, you are going to start with 8 squats. After 3-4 days, increase it to 12. By the end of the week, increase it to 16. And slowly increase your count, depending on what you feel comfortable, depending on what you feel right for your body. This is called the Vajrasan position. Now, when you're sitting in a Vajrasan position, a lot of times mothers have asked me this question, even during classes, that is this safe? Does it get the cord around the baby's neck? Is this causing any harm? Not at all. The Vajrasan position has a lot of benefits. First and foremost, most importantly, it straightens out your back. So it will help to reduce backache. Now, if you look at the way this woman is sitting, it is also separating her abdominal cavity from her ribs, from her lung cavity, right? So due to this, the entire digestion process is better. Women who do Vajrasan regularly after meals for 15 to 20 minutes generally don't have digestion issues. They generally don't have acidity issues, because the stomach, see, unfortunately, we can't change your pregnancy situation. The uterus is growing, it's pushing against the stomach. The stomach has no option but to push upwards, and then it pushes against the food pipe, and there is a lot of acid reflux, and etc. So it's a good idea to sit in a Vajrasan position after meals whenever possible, because it will help you in your digestion. It will help you in your back pain also. Now this one's really interesting. It's a wall push-up. Now when we're looking at wall push-ups, the best advantage, yeah, of course, push-ups, it helps to strengthen the arms, etc. But let me tell you a secret. The reason why I want you to do wall push-ups is because it helps to tone up your breast muscles, right? One of the first changes of pregnancy is size change of the breast. The breast becomes super sensitive. The areola becomes dark. The areola becomes sensitive. The nipples become really erect and pointy. These are all normal hormonal changes. You may also find that sometimes you leak a little bit of liquid from your breast. This is breast milk and it's completely normal. So if it's a little bit, it's completely normal. You don't need to worry about it. Some women may not get it, and that's also normal. So don't worry about that as well. Okay? But because the size is changing, there is a good chance that there will be sagging. And because there is sagging, that is something that we don't want to happen, right? So we are going to do wall push-ups on a regular basis. This is something which is good for our entire body image more than anything else, right? Here is a very simple exercise. You can sit on a chair and you need a filled water bottle. If you can see right under her feet is a filled water bottle. And what she is doing is she's placed her feet on that and she's going to roll the bottle back and forth, back and forth. This is going to be a nice gentle massage for the soles of her feet. Many women, because the weight increases, because of wrong footwear, when they're standing, there is a lot of pressure on the feet. Some women, in fact, a lot of women will also say that their foot size changes during pregnancy. I mean, really, it does. So many women will change one number foot size also during pregnancy. Also, there is swelling, so that can also increase the foot size. So it's very essential that you try this exercise. It will help the soles of your feet. It will reduce the pain. It will reduce the discomfort. You'll be able to move around much better. This one is also a great exercise for your circulation for your feet, especially if you are getting, cramps in the legs, if you are getting swelling, your feet are starting to look like elephants, right? So everybody tells you, keep your feet up on a pillow, keep your feet up on a pillow. See, understand, when you have swelling, your feet have to be elevated. And the only way the circulation will reverse is if the feet are elevated above the heart level, right? So if you put your legs up only on one pillow, the pillow is really tiny and it will get pressed and your feet are just there only. So the swelling does not come down. So when you elevate your feet like this up against the wall at a 90-degree angle if possible, all the fluid retention or the circulation which is slowed down, the fluid will come rushing back to the heart because it has to come back towards gravity and your swelling will reduce. So this is a great tip which you should keep in mind. If it is still not reducing, I'm going to go back to the original statement. It could be due to elevated blood pressure, and that is something which should be discussed with your doctor. You should not ignore it. So definitely try this. Another thing for swelling that you can try is soaking your feet in some warm water. It feels amazing. So take some warm water, maybe you can put some rock salt in it and soak your feet in that for 15-20 minutes every evening, especially after you have been standing for a long time or sitting in one position for a long time, which I know you're not going to now. You're going to get up and you're going to walk around. You're going to do your foot flexes and ankle rotations. But still, this is also a quick tip which will help you as far as your feet are concerned. The next thing that we are going to do is deep breathing. Now, deep breathing sounds so simple. I mean, really, that somebody has to teach me deep breathing? Yes, of course. We have to teach you deep breathing. And the reason we have to teach you deep breathing is because it helps to build your lung capacity. What am I going to use that for? Labor, definitely. When I'm pushing that baby, when I'm, kind of doing all my labor breathing exercises, I need to have lung capacity. The other thing is to provide adequate oxygen to the baby. Your lungs have to work at 50% overtime capacity. So they need to be strengthened. They need to build their capacity. How are we going to do the deep breathing? Let's try it together. Just sit back comfortably. Make yourself as comfortable as possible. Now take a deep breath in all the way till your lower abdomen. Don't hold your breath anywhere. And exhale. Let's try it one more time. Take a deep breath in all the way to your lower abdomen. And exhale. Now try it one more time with full awareness. Deep breath in. Expand your lungs. Open out your rib cage. Keep going. Swell up your abdomen. And slowly exhale. Imagine that you're a balloon which is filling up all the way till its bottom and then emptying out. So inhale and exhale. A few clauses. You are going to do your deep breathing about 40 to 50 deep breaths every day. Do it first thing in the morning because that's when the air is the freshest, and don't do it in an air-conditioned environment. Do it with your windows nice and wide open with nice deep breaths. You get some lot of oxygen inside and it's really, really good for your body to prepare yourself. Then comes Kegels. Now, Kegels are your pelvic floor muscles. And these are very important exercises. I'm going to try and explain this to you. Any which ways I had to explain this to you. There's no visual for this because we're talking about your vaginal muscles. Never ever do Kegels in the bathroom. Never ever do Kegels while urinating because we don't want to damage your bladder. Okay? We will only do the Kegels outside the bathroom. But the muscles that you're going to imagine are the muscles which stop the flow of urine. So let's try it together. And you can do this sitting. We're just going to do a few. So imagine that you need to pee and I'm not letting you get up. I'm a really mean lady. Okay? So we're going to hold the vaginal muscles and we're going to slowly release. Now when you're holding them, please ensure that your breathing is normal. Your abdominal muscles don't tighten. Okay? Let's try it now. Just very quickly, few counts together. Hold and release. Hold and release. Hold, release. Hold, release. Hold, release. Hold, release. Okay? Got it? Got the hang of it? Breathing normal, abdominal muscles normal, only holding the vaginal muscles. How many should we do every day? Okay, now that's a big question. What you are going to do is you're going to do at least 150 to 200 Kegels every day. Did I say that correct? Yes, I did. 150 to 200 Kegels every day. Of course, start with about 30, 40 and then slowly increase them. Okay? I don't want you to do all 200 together. Make a trigger. Decide on your own personal trigger. I'll tell you my personal trigger. I would do my Kegels every time my phone rings. And my phone is a PCO, right? Right now, in the current COVID situation, I said every time I do a webinar, I'm going to do my Kegels. And trust me, don't ask how many Kegels I get done. Right? So Kegels are something which a woman should do during pregnancy, should do post-delivery, and should also do all her life. So during pregnancy, it will help to prevent urinary incontinence because so many times, in the 9th month, you laugh, you cough, you sneeze, a little urine leaks. We will help to prevent that. For birth, it helps to strengthen the actual pelvic floor from where the baby has to pass through. So the pushing part, when you're actually delivering the baby, that can become a little bit more smoother. After delivery, you want your vagina to go back to shape, isn't it? Because we do need to get back to normal life. You don't want your vagina to be all loose and floppy. So start doing your Kegels regularly because such a big baby has come out, it's gotten stretched. Let's bring it back to its original, tone and elasticity. And as you grow older, urinary incontinence, bladder prolapse, uterine prolapse, all of these things are realities for older women. So this is one thing I love to say, and I'm going to say this to you as well. Whatever you do, whatever you learn from this class, but this is one exercise that I'm teaching you for the rest of your life, and I would love to be remembered for the rest of your life as the person who taught you something which was a gift for life. Okay? Now I'm going to also teach you some labor breathing. Okay? I think that's something which everybody waits for. So we've taught you so many things which are going to help you during labor and of course help you during pregnancy. But during labor, deep breathing sometimes does not work. And therefore, we have to do short breaths. So since, of course, you can't see my visual, I'm going to be very, very graphic and I'm going to explain it to you. So you can sit and you can do it with me. Just sit back, be comfortable, close your eyes, prepare your body. Now take a deep breath in, exhale, breathe in through your nose, blow out through your mouth, and it has to be really short breaths only to your chest. So the first one was all the way to your abdomen, now it's only to your chest. Keep going, short breaths. Breathe in through the nose, blow out through the mouth. We're going to do this for 30 seconds. Just make sure that you don't get breathless. Just keep doing it for about 30 seconds. And you can feel that the contraction is gone. So take a deep breath in and relax. In between contractions, there's no pain. So what do? You relax. You conserve energy. You don't stress yourself out. You just focus on yourself and you enjoy the moment. Always think positively. Every contraction brings you one step closer to the baby. Never think about it like this and oh my god, every contraction is a horror. That's going to make it a horror, right? So just relax. Breathe normally. You can feel another contraction coming on. Take a deep breath in. Exhale. Inhale. Exhale. Breathe in through your nose. Blow out through your mouth. Short breaths. Only till the chest. Abdomen is not moving. We'll just do this for 30 seconds. I'm being really good. I'm doing really small contractions. And you can feel the contraction disappearing. Take a deep breath in and exhale. Right? Okay, amazing. So now what are we going to do? For all of my lovely mamas who are 28 weeks and above, that means you are in your third trimester, you are going to practice this every day. So you keep a clock in front of you. Start with 30 seconds of the short breaths. Then do 30 seconds of normal breathing and relax your mind. Then do 30 seconds of the short breath and then 30 seconds of complete relaxation. Do this 5 times. Slowly increase because real labor contractions in absolute intense point can even last for 90 seconds and they don't give you such long breaks, right? So you may have a contraction every few seconds, maybe every minute or so. So you should prepare yourself. So do 5 such contraction breaths every day and tell yourself that you can do it. All right. So that was a lot of content from my end. And as I told you guys, we have a little gift for you. And the gift coupon is for Bumberry, which is the eco-friendly diaper. And I think a lot of mothers have this myth, right, that diapers can cause rash, etc. So now here you have a diaper which is completely cloth and it's something which is possible for you to use. So when the Cordlife team gets in touch with you, they are going to, they are going to be giving you this voucher, plus they're going to share the recording of the session with you. And they might also request you if you would like to learn more about stem cell banking to take a presentation from them. So that is all, that we are going to be focused on. So, Dr. Pallavi, hi, would you like to add a few words?
Thank you, Sonali. Thank you so much. You really have inspired all of us to love yoga coaches with your wonderful presentation. Love you for that. Thank you.
Thank you.
Okay. So most of the women, the pregnant moms, expected moms out there, your mind must be only with one doubt. Is it okay for me to do? When is it that I'm not supposed to do? So Manu has been telling all through, but just to stress off, the 3 conditions where you need to avoid yoga is when you have pain, lower abdomen. Okay? Significant pain, but not just a fraction of a second like that. And the second thing is when the lenses are low lying. That's usually called upon the scan when you go for a biology scan or a any scan. Now the third condition is where there is a cervical stitch lying to the mouth of the uterus, especially in cases of twins or nine-line passage. Except for these 3, there is no contraindication to yoga. So rest your fears aside. Right, Sonali? Do you say with me on that? Yeah.
Yes, completely.
Yeah. So, lovely ladies out there, use yoga as exercise and fluctuations of the thought habit. So, I know one disease which is catching up with this generation ladies is excess thought habit. Stop your mind, put a tara to your brain for some time. And thinking with your breathing, Madam has told about deep breathing, right? That was a wonderful job to clear your blood of the free radicals, the so-called toxins of pregnancy, which cause all the low life, early pains, water breathing and all. So all the Pathological problems which occur in pregnancy are somewhere seen to increase the inflammatory reaction to toxic substances. And these you can really brush off from your body by using this yogic principles. Okay? So ideally, exercise the body is like somewhere to a plan. Please go ahead, give yourself and your baby this nourishment. Right?
Okay.
At least some yoga poses every day in tomorrow, girls. Okay? Thank you.
All right. Okay, ma'am, we have a lot of questions. So can I read them out for you so that you can answer them for our mothers?
Yes, Sonali, please.
Okay. All right. So the first question is, can COVID-19 be passed from mother to her newborn baby or fetus?
Depends on which trimester you have been attacked with COVID. Okay, if it is in the last third trimester, yes. Right? If it is very new in the first part of third month or fourth month, no. Okay, and it all depends upon the immunity and the antibodies your body generates to fight COVID.
Okay. And what about for the newborn baby, ma'am?
Most of the newborns are having a protection because of the maternal antibodies.
Okay, so but if the mother has not had COVID during pregnancy, but she gets it after her delivery, then she can pass it to her newborn, right?
Depends on the stage of post-delivery status.
Okay,
Okay.
all right.
So
Okay.
it can be passed on with two things. Is it a maternal fetal-maternal transmission in utero, or is it breathing air that the mother is passed on to the baby while feeding, etc.?
Right. Okay. Then are pregnant women at an increased risk of contracting coronavirus?
Yes, especially if they are immunosuppressed and diabetic mothers. Okay? Mothers who follow yoga are better protected. Okay?
Okay.
Doing yoga.
Exercise builds immunity. That was there in my benefits. Okay.
Let me just give it in detail, Sonali. Pregnancy has such immunosuppressant condition. So immunity is little low, so that your baby, your mother knows the baby to grow in the uterus. Okay.
Right.
So by and large, if the mother has regular good health and she's not an asthmatic or a diabetic, most of them have good immunity. So women who have predisposition for respiratory illnesses have an increased risk for COVID, like asthmatics and anemic patients. So please make it a point to maintain your hemoglobin up to 11 at least.
Okay. So there's another question from a mother who's asking, is it safe to give birth at a hospital in the current circumstances?
Absolutely, yeah. We are all there in the hospital 24/7, 365, and even in the corona time. Okay. Right.
Otherwise, my dear, where will you give birth? You will have to give birth at home, and that is not the safest option. You know, you might as well be in a safe facility where you have all the medical attention to give birth safely. Okay, so I have another question from a mother who's asking, should visitors be allowed after mother and baby are back home?
Absolutely no, for at least 3 weeks.
All right. And right now in the COVID circumstances, so I think everybody's so paranoid. I don't think you should allow visitors to your house.
Yeah. Right.
Okay. How can a pregnant woman protect themselves from the COVID-19 virus?
Yeah. Basically not going out, the importance of all those precautions being shown on the web or television all make sense. Social distancing, totally avoid going into an air which is taken over by many of the public, like getting vegetables on your own, going to the super bazaars. These two, and the third in the list is hospitals, yeah, actually. Okay, so we are there avoiding hospital visits. I mean, we are not, the frequency of the hospital visits has been decreased because we want you to come only when it is a really required visit. Rest all is being managed by the intense patients actually. Right? So please avoid visiting super bazaars, vegetable markets. Don't allow the people who are from your home or visiting the social places to come and contact with you directly after they come back home. Let them shower, and clear off, and then come near the pregnant mother or a delivered mother and baby. Okay, so first is avoiding the exposure itself. Second is, in case you have to go, please wear double mask, and a cloth mask is of no good use. Please note it, only an N95 or surgical mask does good. A 3-ply surgical mask goes in for protection of 90% plus. And N95, it is about 97%. Okay?
All right.
Especially in case, if you can take this message, cloth mask, don't depend on it. A 3-ply surgical mask is a must if a pregnant woman is going out.
Right. Okay,
Right.
so will I or my support person be tested for COVID-19 before I give birth?
If symptomatic, yes.
Okay, so if you're symptomatic, then be prepared. We're definitely going to test.
Yeah.
Okay.
A mother who is coming for delivery is either way being screened. Okay.
Right.
So the level of screening for COVID at admission into hospitals is the 3 levels. One is rapid antigen testing, which is a placard test. The second is RT-PCR, so which is mostly done by the government now. The third is a high resolution CT scan of the chest. Okay.
Okay.
So if the patient is symptomatic, we do both RT-PCR and HRCT at admission. If patient has never had a history similar to COVID symptoms, only an RAT may be enough to give you entry into hospital admission.
Okay. All right. Now there are some exercise related questions also. So let me see how best I can answer them. So the first one is saying do these exercises in all the 3 trimesters. So the recommendation here for you is that first and foremost you should ask your doctor. And we normally recommend that you start after you complete the first trimester so that you can get a proper detailed ultrasound scan. We know the complete status of your pregnancy. If everything is healthy, then you can start doing the exercises and then again start doing them really slowly. Then there is a question on which month do we have to start doing Vajrasan. Again, as soon as you feel comfortable, once your doctor gives you the go-ahead. This is a sitting posture, so many times you can sit in Vajrasan position even in the first trimester depending on your comfort level. So now I have one question, ma'am, for you. I am 28 weeks pregnant. My placenta is low. And can you suggest something for me?
The shoulder and the neck rotations are fine for you.
Yeah.
Okay. Sitting gently in a chair and doing your leg rotations without extending them to the knee above level is safe for you. Okay. Rest of the asanas hold on for a month. Probably the growing uterus will pull up your placenta.
Right. Okay. All right, ma'am, there's one more question. They want to know what about intercourse during pregnancy? Is that safe and normal?
It's safe after 28 weeks till term, provided the placenta is not low-lying.
Okay, no, this is another mother who's asked this question.
Okay.
Okay. All right. So for intercourse, the best bet is always ask your doctor and ask your doctor at every visit, So even if you have permission at one visit, it is better to always check in again. So it's never something that, full permission for the entire term that you are there. You never know how pregnancy changes. So always keep checking in. And don't be embarrassed to ask this question. Right now on this open forum where you've only typed, many mothers are asking this question, but in the doctor's office, they feel shy. So don't feel shy. Please ask the question. It is all about your body and it's all about your health. So you should always ask freely. Okay. Can we go to another state during the 7th month of pregnancy in this COVID situation? Basically, I want to know, is traveling safe or not?
By air or by road?
She has not mentioned that. She's basically going to another state. So maybe you can answer both.
Yeah, the general guidelines follow the state. If any aggravating factors like a low-lying placenta or a precious pregnancy or history of repeated miscarriages is there, try to avoid. Short distances like a 100-kilometer drive and all doesn't matter. Okay? But when it is a 7-hour drive, 8-hour drive by boat or long journey more than 2 hours by flight, do individualize your advice with your doctor. In general, if the abdomen is not contracting and absolutely relaxed with a placenta which is not low lying, it is taking valid.
Okay. All right. What is the best sleeping position in the third trimester?
Yeah, I'll take that, Sonali. It's called the left lateral position.
Yes.
Okay. When a pregnant mother sleeps on the back, there are major vessels in the human body which lie beside the spine. So the pregnant uterus, which is already weighing around 3 to 5 kgs minimum in the beginning of the third trimester, will put a mechanical pressure effect on these vessels. So the blood circulation from the feet doesn't go up to the heart. The blood circulation from the limbs doesn't reach the heart. So just because of the mechanical pressure. So we advise after 28 weeks to lie down on the left facing position preferably. In case you are very uncomfortable, try sleeping to the right side for a while and shift. But sleeping on your back may be a strict no from my side after the 9th month on.
Okay. All right.
Right.
Now there's a question now she's asking, when can I start my breathing exercises? I would suggest starting, yeah, from 28 weeks onwards for sure. So she is in week 32. You should have started. Please start right away.
Okay.
Right away. All right. So I think that's the last of the questions that I had. And there is someone who wants to know, when are the next sessions going to be organized? So we will be in touch with you. We will discuss it with the doctor, and then we will definitely invite everybody for the session. And I hope I'm also invited back. So definitely, right?
Yeah. We work in the teams and Mother Sarah, please take this as a starting opportunity to enter this field of giving balance to your exercise for my pregnancy. This session should burst all the myths out there for people who are hesitating to take up yoga in pregnancy. Right, Sonali? Okay. So, back to our doubts regarding the medical sessions and all, please contact the people and free to answer your questions. Please place your questions to them as well, and I'll get back to the reply soon. Okay.
Right. Awesome. Thank you so much, ma'am, for your time and giving us so much valuable insights on various questions related to COVID. I think that was a big question that every mother has, because it's such a scary time.
So, no need for all the effort. I wish this video would have worked well. It's okay.
Yeah,
Okay.
Doesn't matter. No problem. We can see our beautiful faces next time round. So I've also put all my social media handles on the page. Please do follow on Instagram and Facebook, and I have a YouTube channel as well. So I look forward to seeing all the lovely mothers there. You can see my face there. That's one thing that I can promise you.
I mean, thank you, Sonali. Thank you, Cordlife, and all the ladies over there. Thank you so much. We will get back to you with replies to all your queries, my dear. Thank you.
Thank you. Thank you. Have a great evening ahead. Bye-bye.
Bye.